How can undocumented immigrants apply for emergency Medicaid? Imagine facing a sudden health crisis and wondering if you can get help, even if you are not a citizen or don't have full health coverage. That's where Emergency Medicaid comes in. It is a special program that helps people with urgent medical needs, no matter their immigration status. If you are an undocumented immigrant and need emergency care, you can apply for Emergency Medicaid to get the treatment you need. To start, you must be a resident of the state where you are applying. For example, if you live in New York, you need to show proof of residency in New York. You also need to meet income requirements similar to those for regular Medicaid. This means your income should be below a certain level, which varies by state. The medical condition must be an emergency, like severe pain, difficulty breathing, or a risk of organ failure. It has to be something that needs immediate attention to prevent serious harm. The application process begins by getting an emergency Medicaid form. You can find this from at local social services offices, hospitals, or clinics. Sometimes, hospitals have the forms available at their financial assistance offices. You will need to fill out the form with your personal details, income information, and details about the emergency. Be sure to provide accurate information to avoid delays. You will also need to submit documents like proof of identity, proof of residency, proof of income, and medical emergency details. Once you submit your application, Medicaid officials will review it. They might ask for more documents or details to verify your information. If your application is approved, you will receive emergency Medicaid coverage. This coverage only pays for emergency medical services, not routine checkups or non-urgent treatments. It covers hospital stays, ambulance rides, and urgent procedures needed to treat your emergency condition. You can usually apply at local social services offices, hospitals, financial aid departments, or through your state's Medicaid website. Remember, Emergency Medicaid is designed to help in urgent situations only. It does not provide full health coverage or regular doctor visits. For Latino households and other immigrant communities, Emergency Medicaid is a vital resource. It allows access to urgent health care without worrying about immigration status. To apply successfully, gather all necessary documents ahead of time and ask hospital social workers or community organizations for help. They are familiar with the process and can guide you through it. In some states, like New York, recent changes have expanded Medicaid eligibility for older undocumented immigrants to full Medicaid. But for most, Emergency Medicaid remains the main option for urgent medical care. This process makes sure that even if you are undocumented, you can still get the medical help you need during emergencies, respecting the rules about immigration status while prioritizing your health.